Hi there, this is Dr. Lena Edwards, and this is a very special treat for the viewers today. I have been fortunate enough to get the lovely Claire Wheeler-Love to talk with me. Claire owns a compounding pharmacy in Lexington, Kentucky. The name of that pharmacy is Wheeler's Compounding Pharmacy. I have worked with Claire for a long time. What's it been, Claire? Maybe 10 years, longer?
At least.
So I really trust Claire. Her pharmacists and the quality of what she does at her pharmacy is really exceptional. And so the reason I reached out to Claire was so that she could help me give information about compounding, some more information about compounding, so women have a better idea of what it is, what's available, etc. And then Claire has some other really important pieces of information she's going to share with us also. So Claire, thank you so much for doing this interview today. Welcome.
Thank you, Dr. Edwards, for having me. I really do appreciate it, your trust in me with your patients and your trust in me for this interview.
Absolutely. So let's just start off by talking about what a compounding pharmacy is and does and how it's different from a regular pharmacy and why you chose to offer compounding services in your pharmacy.
Sure. Okay, so compounding would be a custom-made medication for an individual patient. And when I say custom-made, I mean it's made from scratch, like baking a cake. You have your raw ingredients, and they're put together in a certain fashion, and they're made specifically for a patient. And it really drew me in because there's a creativity involved. Of course, there's science involved, and it was really something different and out of the box. And when we were trained in pharmacy school, we learned the basics, but it wasn't. They never really taught you why you would want to compound. Why isn't one of these, 150 drugs on your shelf going to work for this particular patient? And so that kind of drew me in, and I just found it to be more, fascinating. And the more and more I learned about it, the more I realized that medicine isn't a one-size-fits-all, and it shouldn't be, and it isn't. And there are people out there with situations where something that is just commercially available on the shelf at any other pharmacy is not appropriate, or they've tried it, doesn't work. There's lots of reasons. They could be allergic to dyes and fillers, so they have to have their medicine made free of those things. They might need doses that aren't available. They also might need certain medications combined into one, just to help with compliance. With hormone replacement, we see that a lot.
Yeah, and that's actually the place I wanted to focus primarily was on the hormone replacement therapy,
right,
and the benefit of compounding and some of the different ways that hormones can be compounded.
Yeah, well, it really gives the prescriber so many more options, because the hormones that are available for regular pharmacies, you do have some bioidentical hormones. You also have the synthetic and the horse-derived artificial type hormones. But you also have limited doses, limited dosage forms. Even, within tablets or capsules, you may only have 2 doses to choose from. It really gives the prescriber so many more options. Because with compounding, we can do any dose wanted, any dosage form. And, here at our pharmacy, we do. I mean, every woman that walks in the door has a different dose. And we make it custom for them. There are some compounding pharmacies that still will say, here are your doses you can choose from, which is still more than a regular pharmacy, but it's best if it can be custom made for each individual person. So you've got, capsules, creams, vaginal suppositories, creams. You've got sublingual troches and drops, and you've got capsules. I think I said that. So many, rapid dissolve tablets. I wrote some down so I wouldn't forget them. It's really fascinating things. And then in the sterile compounding world, there's also injections and pellets and some things. We do non-sterile only, but they are available.
Okay.
Through sterile compounders.
So I guess what are the most common, I know when I'm prescribing bioidentical hormones, there's a specific way that I do it based on science, obviously safety, and, obviously just because the bioidentical hormones are coming, what's the source? Because that's another, I know the source, but a lot of people ask me, well, where do the hormones come from? So where do they come from?
Yeah, so that's kind of a loaded question because everyone wants to say, well, are they natural? Well, yes and no. um, so most of the hormones that we work with are originally derived from a plant source.
Mm-hmm.
So they're derived from yam or soy. That's the typical place.
Mm-hmm.
And the reason being is that the chemical structure is already starting out to be similar to what our bodies have.
Mm-hmm.
But then it goes to a lab at that point. And so when when people ask, well, are they synthesized? Or, well, yes, they are.
Right.
But the final product, so they take the yam or the soy and they take the hormonal molecules
Mm-hmm.
and they change them in the lab to be identical to what we have as humans.
Mm-hmm.
So they are synthetic, but they are bioidentical.
Right.
So I think you've addressed that in previous.
Yeah, that's a really important distinction though, because I think that there are actually commercial, as you mentioned, there's commercially available hormones that are technically bioidentical. I mean, estrogen patches, estrogen pills,
Mm-hmm.
really bioidentical means that the biochemical molecule is the same as the biochemical molecule of the hormones that we still make or don't make enough of or don't make anymore.
That our bodies naturally have.
Exactly. So just because it's made in a lab, that's not really what's making it the bioidentical. The bioidentical is really the biochemical structure being the same.
Right.
Okay.
Exactly.
So tell me a little bit. Obviously, compounding has a lot of different benefits because, as you pointed out, prescribers can choose individual doses based on a patient's symptoms and the patient's lab results, etc. You've done this a really, really long time. What are some of the more common mistakes that you see being made? Because I know that there's an art to doing this. Okay. So what are some of the things that you see that you sort of cringe and you're like, wow, I wish I could, do something, because obviously you can call the prescriber and make some suggestions, but you can't change the prescription. So,
exactly. And
so tell us a little bit more about that whole, I know I'm opening a can of worms, but that's what
you are. Like, how much time do we have? Because
that's what I do.
I see it all the time. And it's, like you said, I'm in a precarious place because I am, educated on the subject and have made sure that I am. And so I can call the prescriber and suggest or ask questions and try to lead them in a certain direction. But at the end of the day, they're going to prescribe what they're going to prescribe. So, the the biggest mistake I see them doing, just as pharmacists in general, is prescribing non-bioidentical. I mean, we stopped using pig and beef insulin as soon as technology caught up to the point where they could make insulin bioidentical to a human. But yet, they're still giving horse-derived estrogen, even though we have bioidentical readily available. So I don't understand that at all. But I could get on a big rant about big pharma, but we both know they have
a conversation for another time.
We both know they have deep pockets and a lot of influence. So I think that's one of the reasons. But that's the biggest thing. And then when it comes to bioidentical hormones, they make mistakes there too. And probably the biggest in that realm is giving unopposed estrogen. Usually you see that in a patient with no uterus. So they still believe that you don't need any progesterone once you have no uterus, which
right. So that's what I was going to explain in case people don't understand what unopposed estrogen means. If you're going to give hormones, in all cases, estrogen should always be given with progesterone, even if you don't have a uterus, because progesterone does a lot of other things in the body that don't even involve the uterus. So, what I guess your point was that you see in women that mainly that don't have a uterus that prescribers will give the estrogen only without the progesterone.
Absolutely, we do it all the time.
What about dosing? Do you see any issues with the dosing in hormones, especially hormone cream?
Absolutely. What I typically see is that the dose, first of all, they'll start them on too high of a dose. Or secondly, they will start them on a dose, and then I'll start to see every other month or so their dosage keeps getting increased and increased
Mm-hmm.
and increased and increased. And so I usually inquire with the patient and
Mm-hmm.
say, you know, what's up? And they tell me that their blood results were low and that they needed more. And so I'll leave, you know, that up to you to explain why improper testing method is probably leads to higher doses than most people need.
Mm-hmm. Mm-hmm. Absolutely. Absolutely. So in general, do you find that your patients that visit your pharmacy are like the ability to get the compounded hormones? And do they seem to do better with them?
Oh, absolutely. I mean, they do better. They feel better. I have a lot of people who maybe started out on a different type of hormone or the
Mm-hmm.
limited hormones that they can get, you know, commercially, and eventually something will lead them
Mm-hmm.
to us. And you know, it's so rewarding to hear after a month or two, I've got my life back. I feel
Mm-hmm.
better. My husband loves me again, or I
Yeah.
love my husband again, or
Right. Right.
you
Exactly.
know, whatever the case may be. And it's just so much better.
Yeah. Now, I also find that there's a misconception, and please, feel free to disagree if this isn't the case, but that sometimes patients think just because hormone replacement is in a cream or a gel and it's bioidentical, that it's safer. And so, what are your thoughts about that in particular with respect to the safety profile and dosing and the way it's being given?
Right. Well, you know, back to the way it's being given, I see, you know, oral testosterone and oral estrogen given still. And as far as this, you know, the safety profile overall, you know, I do have to explain to my patients that hormones can be harmful if dosed incorrectly, dosed, you know, too high, incorrectly, not balanced, and that the key is to get them all working in, you know, in a way that they're all working together for the benefit of the patient. And
Mm-hmm.
um, I, it's not just about, and this is, you know, it's not just about, oh, you're low in this hormone, let me give you some hormone.
Right.
You're low in this, let me give you this. You're low in this, let me give you this. It's a, you know, one of the biggest things I see prescribers do is just treat with hormones.
Right.
And they don't understand the complexities of how it interacts with everything else in your body, and your
Exactly.
cholesterol, and your blood pressure, and your sleep, and your um, thyroid, and your adrenal glands, and you know how it's all interrelated. You're
Right.
an expert at this, and there's very few prescribers out there
Mm-hmm.
that are. So it's hard to see that sometimes, and I
Mm-hmm.
just try to guide the patient as best I can to look at other things and not just,
Mm-hmm.
you know, do hormones.
Right.
That's
So one other question before we conclude, one of the main questions actually I wanted to ask you is because it's impossible enough to try to find a knowledgeable physician to work with, but how does a patient choose a compounding pharmacy? Because if you're not working with the right compounding pharmacy, it doesn't matter how smart your doctor is. If the compounding pharmacy doesn't know what they're doing, then that's a huge problem. So I work with women all over the country, and I'm constantly being asked, well, how do I find a compounding pharmacy? What do I look for to know that I'm going to be working with someone who is going to do what you want and is going to do it well?
right. Now that's a good question because um, unlike the regular pharmacy where you're going to the shelf and you're getting something off the shelf and it's been manufactured and it's been gone through all this, you know, testing, compounding is patient specific. We're making it for you from the, you know, order of a physician. So there's a couple of things you need to look for. First and foremost is the pharmacist that you're working with that, you know, is in that compounding pharmacy or regular pharmacy that does compounding. Are they educated on it? We get very little compounding knowledge in pharmacy school. It's your basics. Here's how you make this. Here's how you make that. So it's very important that the pharmacist that you work with has been through a lot more education and training, um, and really knows what they're doing, not only with the compounding of the product itself, but, in this case, is knowledgeable on hormone replacement therapy, bioidentical, because it's not all, we don't, you have to seek out this knowledge. It is not handed to us at pharmacy school, just like it is for the doctor.
Mm-hmm.
And, secondly, I think that it's important that the pharmacy that you choose has a very robust quality assurance procedures and program in place.
What does that mean? Can you explain what that means?
Sure. I mean, if they're just making a product and then just, scooting it on out the door with no testing, no proper equipment, it's really, you don't really know what you're getting.
Mm-hmm.
It's a complex, to compound anything, much less hormones, is pretty complex.
Mm-hmm.
So you have to have that extra training and knowledge, and you have to have the staff that is fully trained and as well. And then the procedures, just like when we make capsules, we, take a sample of the capsules and we weigh them to make sure they're within a desired range. And then we also periodically send off our products for outside lab testing.
Mm-hmm.
And that's not so much to test the product itself, because that's only one product or a sample of one product. It's to test your processes. Is what you're doing in the lab creating what you're supposed to be getting,
mm-hmm.
or what you're prescribing? And I think, and how do you know? How do you know if the pharmacy is doing that? That's the thing.
Right.
You ask. You'll
that was going to be my question. How do
you'll
people
know?
Can you call and say, did your pharmacist get extra training? I mean, I think that's what I was going to ask you.
Sure.
Is it okay to be that bold for patients to be able to be sure?
Absolutely, and they need to be, because there's no set necessarily guidelines for compounding pharmacies. It varies from state to state.
Mm-hmm.
There are good practices that we all want to do, but we want to make sure that, or you as a consumer want to make sure that that pharmacy is going above and beyond what is required by their state, because sometimes it is minimal.
Mm-hmm.
And it's okay to ask. I get these questions. I don't mind answering them, because I know that I'm knowledgeable and that that we do the right thing here and we do it well.
Mm-hmm.
So I don't, any compounding pharmacy that doesn't want to answer those questions, I think you would have to be leery of.
Mm-hmm.
They may have something to hide. They may not have the training. I can tell you anything you want to know. I can tell you from start to finish how we make that product, and I'll even show you my lab
Mm-hmm.
where they do it.
Mm-hmm.
So I think that's what you need to look for. Don't feel bad about asking those questions, because this is your health
Mm-hmm.
and your well-being, and they're not all created equal.
Right. And what I found when I'm working with patients, and I explain it to them, if, as you pointed out, since you're making the product for them right then and there, brand new each time the prescription comes in, just because you use the same recipe to make a loaf of bread, it can come out 10 different ways the 10 different times you make it. So if you're not using quality ingredients, if the person that's making the bread doesn't know how to work the oven, all of those things are really important as part of the process, obviously.
Well, I think it's important to remember too that anybody that is doing things the right way and they're using quality ingredients and they're using, they've trained their staff properly, all these things cost money to do.
Mm-hmm.
And so you're not going to get the cheapest product. If you shop around for the cheapest hormone cream, you're going to get the cheapest.
Get what you pay for.
You get what you pay for. It is.
Mm-hmm.
So, it should be in line with other compounders in the area. And if they try to undercut you and it's half the price of somewhere else, then I would run.
Yeah, I agree.
They don't have your best interest at heart.
Absolutely. Such wonderful information. Is there anything else that you might want to share that you think the viewers would be interested in knowing about?
Oh, wow.
You're right. That's a loaded question.
Yeah. I mean, I just feel free, I guess, to call me, email me. It's claire@wheelercompounding.com. You can call us at Wheeler's Custom Compounding in Lexington, 554. Well, I guess I should include the area code, huh? 859-554-2716. Feel free to call me. I'll answer any questions that you have. I know that Dr. Edwards knows what she's doing, prescribing, and I don't question the things that she sends in, that's for
Well,
sure.
that's good to know. I've
Of
just,
course.
yeah, done it for a little while, but yeah. So anyway, well, Claire, thank you so very, very much. And again, it's Claire Wheeler Love. She is the owner of Wheeler's Pharmacy in Lexington, Kentucky. And your number again, 859.
554-2716.
Okay,
It's
excellent.
Wheeler's Custom Compounding.
Wheeler's Custom Compounding Pharmacy, because you also have a regular pharmacy.
Yes, we do also have Wheeler Pharmacy.
Yeah, because having one wasn't enough work for you. Okay, good to know. Thank you again.
Thank you, Dr. Edwards.